Can you imagine going to the doctor to get answers to your questions as to why you don't have a period at the age of 16, only to get it might be PCOS? Well, on today's episode, I want to dive into what are some of the symptoms I experience versus what doctors' prerequisites look like to have PCOS and how you can self diagnose. Now, thank you for tuning in to today's episode. This is my podcast, Cancer at 34, where I bring awareness of facing cancer at a young age and finding hope in the midst of it. Now, in today's episode, I wanted to talk to you about how this episode is actually quite hard for me because it's hard for me to hear more information about PCOS as I am still on the journey to healing because I didn't get help sooner when I was younger. So it's hard for me because it took me to have cancer to start doing more research and then being able to find a doctor that speaks, like for example on podcasts, to that have helped me to feel seen and to feel validated about what I was experiencing personally. So for years I was not able to get a complete answer from doctors as to why I was experiencing no periods. Now, they just suggested to take birth control to help me regulate with my period. They never took the time to even do further exams with me. So now I want to get more information, so from a specialist that I was listening to. She's a world-renowned OBGYN doctor. Her name is Thais Alabida or Alabid. I can't pronounce the name. I'm sorry. But she's also known as Dr. A, and she shares on her podcast, She MD. She said she did share a lot of information on PCOS patients that she has helped, and she's worked with these patients for over 20 years. And so she has specialized in PCOS patients, but she talks about also breast cancer, regulating hormones, endometriosis, postpartum depression, fertility, and a lot of other topics that she talks about on her podcast. So I definitely want to encourage you to listen to her podcast. Again, her podcast is She MD. You can find that on TikTok, YouTube, and I think she might even have a page like on Facebook. So go ahead and give her a listen. She's very helpful and insightful. And I do know that a lot of people don't know what PCOS means or what it even looks like. But PCOS is a condition that goes undiagnosed in about 75% of patients because they get dismissed a lot by doctors. Now, PCOS, it stands for polycystic ovarian syndrome. And in some cases, in order to meet the criteria of PCOS, patients tend to have irregular periods, weight issues such as losing weight or gaining weight very rapidly, or they have like excessive hair growth either on their chin. They'll have excessive hair growth there. They'll have it in their other body parts. So those are some characteristics that PCOS displays, and if you're like a poster child of PCOS, but this is not for every case. And so other things that you can tell with PCOS patients, like at an extreme level, are male baldness, facial acne right here in the jawline. You can see hormonal acne coming out, and there's insulin resistant in these patients. Or when they have an ultrasound done, they also have giant cysts on their ovaries. Now, in my case, this displayed a little bit different because when I was first diagnosed, I was not like significantly overweight. I was more so around my weight range. And I was quite skinny at the age of 16. So I didn't think that I met this criteria. But what I did notice was that I had extreme mood changes. I went from feeling tired, and then it was hard for me to like get up in the morning. Sometimes I would drink coffee to get myself that boost to be awake. And it always felt like, for some reason, my headspace was like in a funk because I couldn't get my thoughts together. I always felt like down. I always felt like something was wrong with me and I couldn't figure it out why. But in reality, what was going on was that there was already signs of depression and anxiety from the imbalancement of my hormones. And there was moments where it just felt like my hormones were out of whack all the time. And so I can remember that because my hormones were, I was either up really, really high, where I had like random sporadic moments where I was really energetic, that I couldn't even sleep. So I remember having that. And then the next day feeling very exhausted, very tired, where I had to drink coffee again to make myself feel better. So it was definitely a hard time for me when I was in college because I wasn't getting much sleep. And according to Dr. A, she mentions in her podcast that girls that suffer from POS usually have higher levels of anxiety and depression. And so for once, that made me feel validated, like I was not crazy, during that time. So when patients that are PCOS patients are put on birth control, it makes their anxiety and depression twice as worse when they're put on birth control. It was one of the main reasons actually why I stopped using birth control at the age of 17, because it felt like I was just spiraling down with my mental health to the point where I was feeling suicidal. And sadly, for some of the PCOS patients that are overweight, doctors tend to tell them that they can lose weight by doing exercise or dieting. And sometimes this isn't beneficial for PCOS patients because there are different forms of PCOS, and PCOS is in a spectrum that's quite big because not everybody meets like a cookie cut criteria of these things. So one of those is PCOS that's insulin resistant. There's PCOS that's inflammatory. There's hidden cost PCOS and pill-induced PCOS. So there's 4 types here that are mentioned, but there's definitely more. And so an example I can give you for the inflammatory PCOS, it's a low-grade inflammation is a hallmark of this type of PCOS. The inflammation can trigger insulin resistance and hormonal imbalances. For example, if I have weightlifting as an exercise that I want to do, right? And then I work out for 30 minutes to an hour of more cardio and weightlifting. I'm probably going to be feeling worse the next day because of that inflammation of working out. It's going to cause more inflammation to my body. Because working out at higher intensity causes more inflammation to the body versus doing low intensity workout. So these are signs, that you discover as you know your body and do more research. And so this is something I actually learned through the SheMD podcast. And then there's also insulin resistant. And this is the most common type of PCOS because it's characterized by insulin resistant. And the insulin is a hormone that helps regulate your blood sugar levels. So imagine that I am trying to change my diet now, as the doctor mentions. And a lot of people think that smoothies is a good option for breakfast. And so when in reality, the natural sugars of fruits, that's going to skyrocket my insulin even more. So when the body becomes resistant to insulin, it can lead to increased androgen production, which androgens are male hormones that can cause unwanted hair growth. And so it causes even acne and irregular periods. And then there's the polycystic ovaries that also display with this type of PCOS, where you see that the ovaries have many small cysts that can interfere with ovulation. And if you're not ovulating, then you're not having a period. And you can't get pregnant if you're not ovulating either. So sadly, there is also a hidden cost PCOS where the underlying cause of PCOS is not immediately apparent because it's a challenging thing to diagnose when the traditional tests that you get done don't show any sign of PCOS. So, for example, you go get blood work, you go to test your hormones, you get pelvic exams, you get ultrasounds. It's probably not going to show there, but there's other symptoms, like I mentioned before, that can be signs of PCOS. And so, lastly, the pill induced PCOS. This can be developed after discontinuing birth control pills. So, this is because the body may need time to readjust its hormonal balance. So, I think it's kind of contradicting when you place a PCOS patient on birth control to try and regulate their menstrual cycle. And then it's important to note that these things are not exclusive. These types of PCOS are not exclusive, because many women may exhibit characteristics of multiple types. So you may experience one symptom from the different 4 types that I just mentioned. So when I decided to go back to visit my OBGYN doctor to try and get help about my condition, I was already the age of 26. So mind you, I stopped birth control at 17, didn't go back to the doctors till I was 26 years of age. So in that gap, I had put my health in the back of my mind, because there wasn't a doctor that could give me any good answer. And I was just hoping that my body would naturally kind of allow me to have a period. So 8 years had gone by for me, to have no help, no specific answer from any doctor. And I just pushed through my life ignoring my body at that point. And looking back at this, I'm sad because I didn't obtain more knowledge about PCOS and how it can lead to endometrial cancer if it's not treated. So what happened to me was that the lining of my uterus had become really thick because there was an imbalance of progesterone and estrogen. There wasn't enough being made. So there was that imbalancement that caused my uterus to become really thick. And so it becomes weaker. And then I needed help learning how to balance my hormones. Is actually what could have helped me to avoid getting to the point of having cancer. But unfortunately, PCOS is not a curable disease, but there's definitely some things that you can do to treat it. So let's go back to some of the symptoms that can be experienced by PCOS, which are unpredictable or heavy bleeding, or go months without bleeding, which was my situation. I went years without bleeding. Having irregular discharge or spotting between periods, which was something that I can attest to, because there was times where I would just have discharge and it wouldn't stop. It would go for a week to 2 weeks and a half. And that's when I believe that's when my cancer was already more advanced. And there's also prolonged periods that you can experience. You can experience dark skin patches or skin tags, mood changes of anxiety, depression, or you can even have a hard time losing weight, and gaining weight can become really easy too. So you can either gain a lot of weight or just have a hard time losing it. Now, it's really hard to pinpoint PCOS because it can mask multiple symptoms. So if I could give some advice, it's to really listen to your body, when you're feeling tired, when you're feeling overwhelmed, if you feel like your hair's just randomly starting to fall out a lot, or if you're just breaking out a lot, like I mentioned before, in your jawline, like in these areas right here, this is where you know that it's a hormonal imbalancement in your body. These are things that you definitely need to listen to your body and not take lightly. So there's also signs of where you need to listen to your body. And these are extreme cases, obviously, that I was experiencing when I was in college. And it's one of the reasons why I stopped birth control. So please take it from me, your body's trying to talk to you, so listen to it. I remember Dr. A she mentioned in her podcast that girls can get their hormones tested. Like you go to a doctor and you ask to get your hormones tested, and they may come back normal. And this is not a indication that you don't have PCOS, because PCOS is known for having that imbalancement of hormones. If you meet the other criteria, you may still have PCOS. So if you're experiencing the other symptoms, you can possibly still have PCOS, but it's just not presented in your hormone exam. And PCOS is also known for causing infertility because of the imbalancement of your hormones, or if you have like enlarged polyps in your ovaries that blocks you from ovulating. And other factors like your lifestyle can also play a big role in affecting PCOS. If you're not sleeping right, if you're not eating right, your body starts to take a toll because your hormones are trying to regulate themselves when you're not sleeping or when you're not eating correctly. So, if you can take one thing from this episode, I would say be your own advocate when you go to your doctor and write down all the symptoms that you've been experiencing. Ask for blood work to get done, ask for a pap smear, because a pap smear is there to see the start of HPV probably forming in your cervix. A pelvic ultrasound, you can ask for that to get a sense of how thick your uterus may look like if you have thickening in your uterus. And me as a friend and as a sister, I wish someone would have given me some heads up or told me what I should be looking for to talk when I go to a doctor or to a OBGYN. So now I'm here for you. I'm here to give you that heads up and to set that appointment with your OBGYN, and go ahead and set that appointment. Like it's definitely something that's important for us as females to be advocating, that you need to get this done for yourself. So I'm here to give you that heads up, and I also think that if your OBGYN, if they prescribe you birth control to regulate your hormones without considering any other exams, then you're probably in the wrong place. Because I believe that people that suffer from PCOS should not just be given birth control without determining what is their size of the uterus or how are their ovaries looking. Does the patient, have a high egg count? Because these are all indicators of PCOS. And half of the medicine that is prescribed to women is definitely made by men. So tell me, like, what do men know about medicine that can affect a woman's body? How do they know it affects women's body? So I definitely want to leave you with this final thought, that paying it forward is never in vain when you pay it forward. I was at the market with my husband the other day, and I think it was like a couple of days ago, and we were in line at the register getting ready to pay. And I could overhear that the person that was at the register with the cashier was getting ready to pay, but she was having a hard time paying. And so I was looking at her and I was like, I think she can't make it to pay her bill. So she went to her car to go get more money, and I decided to pay the rest of her bill. So when she came back, she said, thank you so much for doing this for me. And she walked out. And as my husband and I went to go grab the bag of ice and leave, the cashier told my husband that she didn't charge him for the ice. So as we were gonna pay, getting ready to pay, the person that was at the register said, you know what, don't worry about it. I got you. I'm gonna go ahead and pay for you. So as we are in the Christmas spirit, I want to invite you to do a good deed this week, as we get closer to Christmas. And, as I always say to you, from one thriver to another, keep thriving.